I'm now delighted to introduce you to Sharon Johnson. Sharon is Risk Education's lead for insurance for New South Wales. Now I'm just going to open up Sharon's mic. Good afternoon, Sharon.
Good afternoon, Linda, and hello everyone. Welcome to this Risk Education Express Knowledge to Action webinar. We're joined today by iCare customers from the New South Wales public and private sector, and we're really delighted to have you with us. Before we start, I'd just like to let you know that this webinar is one of a diverse range of risk education opportunities available to our New South Wales government agencies. If you'd like to know more about what's available, just go to our Insurance for New South Wales portal. But on to today. We're very excited by this webinar. So today's webinar is about creating mentally healthy workplaces and where to start with your workplace strategy. This is one of iCare's initiatives for our Mental Health Month, which actually ends today on Halloween Day. And we'd like to celebrate this and also acknowledge its importance. What I'd like to do, it gives me great pleasure to introduce you to our moderator for today, Jennifer Cameron. Jen is the Injury Prevention Manager, Insurance and Care at New South Wales. Jen is really passionate about this topic, and it gives me great delight to now hand over to Jen to get us underway with the panel discussion. Over to you, Jen.
Thank you, Sharon. Hi, everybody. So mental health is something that's relevant to all of us. It's relevant to everyone that's dialed in today or who might be listening later on, because we all have mental health. So it's something we need to be aware of because it's not static. Our mental health sits along a continuum where it can be good one day and poor the next. So it's a really important topic for all of us to be engaging in. From a global perspective, we know that mental health is impacting everyone. So the World Health Organization confirmed in April last year that depression is the leading cause of ill health and disability worldwide, and more than 300 million people are now living with depression. So that's an increase of 18% between 2005 and 2015. If we bring that back a little closer to home and think about New South Wales, we know that 1.2 million people in New South Wales, that's 17% of the population, will experience mild to severe mental ill health in any given year. And a further 23% of the population are believed to have an undiagnosed mental health problem. Get to the right slide there for you. So you can see how mental health is an important conversation from a global perspective, but also a local and community perspective, and absolutely a workplace perspective. So mental health in the workplace is definitely a hot topic. When I'm talking to iCare customers, when I'm talking to employers, it's absolutely something that they are discussing as an emerging risk, and it's one of those things that many employers don't quite know where to start with a strategy or how they can support their workplace to improve mental health. So we're really excited today to have two amazing researchers and clinicians to talk to you today about this topic. So I'd like to introduce you to people that you probably don't need much of an introduction to if you are interested and follow the research on mental health, but we're incredibly lucky to have Professor Nick Glozier and Associate Professor Samuel Harvey with us today. And I'm going to share a little bit of their backgrounds with you. So Professor Nick Glozier is a Professor of Psychological Medicine and Psychiatry at the Central Clinical School and Brain and Mind Centre. So not only is Nick a psychiatrist specialising in epidemiology, clinically he also works with the local health district. In the time that Nick has been in Australia, he's received a wealth of funding, and much of his research has looked at that concept of mental health in the workplace. Nick is a sought-after consultant to numerous organisations across industry for them to get his input. And we're also incredibly lucky to have Associate Professor Samuel Harvey with us today. So Samuel Harvey leads the Workplace Mental Health Research Program at the School of Psychiatry at the University of New South Wales, and many of you would know Sam with his work associated with the Black Dog Institute. So some of Sam's research has been pivotal in looking at how we approach mental health and mental well-being in the workplace. So we are incredibly excited to have these two amazing people to talk to us on the topic today. And that brings us to our first question for the panel. So I'm going to start with Nick. So our first question is around the trends, around what has changed with regards to mental health in the workplace. So we'd love to hear from Nick with regards to the work that he has seen or worked on and the trends that he's observed. So over to you, Nick.
Okay, thank you very much, Sharon, and hi everybody. Very pleased to be here this afternoon. I'm actually just going to talk through some slides because we've got a little bit of data around some of these. And I think we're going to talk a little bit about Australia, but also talk about the effect globally. And one of the things that we see with the trends is that the trends in Australia often track what happens in countries like Canada and the UK and Northern Europe by about 5 to 6 years. So it's often very useful to look at what's happened elsewhere to see what's going on here. Firstly, across the globe, and what you can see here, all the different countries really reporting that people think that their work conditions are deteriorating. So these are the people, who think that they are under high levels of job strain, and it changes from country to country, anywhere between 15 and 35%. But the single common thing is work conditions are worsening. Also, and certainly that's the view of people, and it seems to be sort of laid out in the statistics as well. But which specific work conditions are worsening? So these are the Australian data on hours worked, and we can extrapolate these out a little bit further to sort of 2015 now. And in fact, actually, the average Australian works fewer hours than they used to. But that disguises a set of things where what we've got lots of people who've become part-time workers, and that lowers the average down. So full-time workers are actually working a little bit more than they used to, and there's lots of people on contracting work and part-time work. We've also seen over the past decade or two an increase in precarity. These are people who are contract workers, have job insecurity, probably not quite as high as you might think from reading the papers, but certainly, it's gone up. If you look for, that's a 5% increase in total, but that's a sort of it's a 20% increase in the proportion of people who are precarious workers. So we're seeing more people employed part-time. We're also seeing more people employed not by the person who they actually work for, or the organization where they go to work. So we're seeing contract workers, and these contracts are changing quite radically, and you've probably seen in the UK the rise of the zero hours contract, where people are guaranteed no hours a week at all. So we're seeing people going to work in workplaces where the person they're working with isn't the person who employs them, or may be responsible, and the increase in sort of labour hire firms. And also we begin to see, and probably a little bit more over the past few years, and unlike the first one where the precarity is generally affecting people in sort of lower and semi-skilled occupations, what we're seeing in people in what are so-called white-collar gives interesting questions about how do you manage the risks? What are the risks for working from home? How do you manage teams? How do you manage communications? What are health and safety risks when more of your workers are working from home? Now, at one level, that gives people lots of control. If I wanted to, just before this, I could have gone and hung up the washing, for instance, which I couldn't do if I was actually working somewhere else. But that control also comes with increasing infiltration of demands across the 24-hour 24-hour period. We have our mobile phones. We're all logged on all the time to our emails. The emails ping in all the time. So there's been an infiltration of work into the rest of our lives. Now, for some people, that trade-off is a trade-off of control versus demand, but for others, that may not be so. We also, and as anyone who's here is aware, we've seen increasing policy recognition of the mental health effects at work. I'm flagging up the Beyond Blue PwC report from a few years ago. KPMG did one with just only a few months ago. And SafeWork New South Wales are beginning to introduce mental ill health or mental health into their brief health checks at work. So there's increasing recognition of the policy and practice in this area. And people are looking for what we might do. And Sam will talk a lot about that in a second. And also, from a government point of view, what are the really big costs? I mean, I don't know if you're aware, the federal government actually spend more money on disability support pensions for people with mental ill health than they do on actually treating anybody with mental ill health. We pay them more because they're not working than treating them. And in fact, our treatment and our interventions to people back to work, the cost, we spend very, very little money on that compared to how much we spend on the disability support pension. And in fact, as with every other country in the OECD, psychological and psychiatric claims of disability support benefits have been increasing, whilst predominantly musculoskeletal conditions have been decreasing. At the same time that mental illness per se has not increased. So although we hear a lot more about it, we're a much more literate country. Australia is probably the most mentally healthy, literate country in the world. We hear a lot more about it, but actual prevalence hasn't changed, with the exception of substance abuse disorders, which have increased a bit. And Sam can talk a little bit more about that aspect of it. We've also got a much more comprehensive view of what the work-based risks for mental ill health are. This is the model that Sam and I and others work on in this area. And I think they break down into three: the sort of job design style risks, classically of demands or control, the number of hours that you have, what your employment status is. Are you a precarious or casual worker? Are you insecure? What your occupation is, and then all the social relationships, which at the extreme end turns into sort of bullying or mobbing. But there are many other aspects of social relationships, and those are changing because of digital technology now. So your social relationships are often conducted through digital technology. I saw a workers' compensation claim a couple of weeks ago that was precipitated by someone putting too many question marks at the end of a sentence, and that was deemed as the harassing behavior. So we've got to learn new ways of communicating and social relationships now. Now, not all the risks are the same, however. Some risks are riskier than others. Not all workplace risks are the same. So there are some, like high levels of demands, reporting to two different bosses, having too much to do, shifting demands, and gives you about a 30% risk, much the same as low control. If you merge the two together, people with low control and high demands, that actually more than doubles your risks. They're more than additive. Social support actually has a less of effect. Organizational change, we often talk about that. It's interesting actually that the data doesn't show an enormous impact on that or strength of the risk compared to some of the others. The same is also true of long hours. I mean, in Australia, you need to get to about 49 hours plus before you start to see deleterious mental ill health effects. Actually, in Japan, it's 60 hours plus because of their cultural things, but it's about 40 hours plus before you see that. Shift work, again, we hear a lot about that, but maybe not as risky as we think from the data compared to some of the other things. So aspects like organizational injustice, job insecurity, and then those aspects of, sort of bullying and other things which actually have high levels of risk that are not there. So some risks are riskier than others, and we need to think about that when tackling them and think about your workplace. Some job types are inherently of higher risk, so managers and professionals have high demands, but equally they also have very high levels of control that enables them to manage that. The bottom line you can see there are what we call the frontline workers. These are the police officers, ambulance, security. They often have very high levels of demands, very low levels of control, and that is often why we see very high numbers of those ending up in work, or a high proportion of workers' compensation cases. So job types have different risks. And finally, the understanding is that people are not a tabula rasa. People have different risks. And in fact, this is our risk prediction modelling that we've been working on in the Australian population of employed people. And 20% of men and 20% of women carry 50% of the risk of mental ill health. There are people, as is recognised in the legal industry in terms of the eggshell skull, who are of themselves have higher risks. So we are seeing a change in the risk profile, but remember, the risks are different, so we've got to think about what your risks are in your organisation, what kind of workers you have, and the kind of people who are there when you're thinking about targeting what you do.
Wonderful. Thank you, Nick. Sam, is there anything more that you would add to that question about what your key observations are that have changed over the last 5 to 10 years? Sam, can you hear me?
Do you know what? I need to press the unmute button and then you can hear me. Sorry about that.
It's okay.
I apologise. Look, the good news is I hadn't said anything terribly important then. I kind of think Nick gave a very comprehensive summary there. I think the point that he made about Australia really overdosing on mental health literacy is an interesting one that I think you know, the amount of discussion and awareness there is around mental health is really interesting in Australia. And it's interesting that as that mental health literacy has raised, then people's perceived stress has raised, long-term sickness absence from mental health has gone up, but that's not being driven by any type of underlying epidemic of mental health problems. It's just the same high levels that were always there. So I think we should take a level of reassurance from the data that actually, you know, what we're seeing now is really a reflection of what's always been there, and we've got so much more knowledge now to actually do something useful about it.
Yeah, great. Thank you. Sharon, are there any questions from the audience?
Jen, I've just popped into the chat pod asking if anyone would like to put a question, but nothing coming through yet. So don't be shy. If you have a question, pop it in. If you prefer not to have your name come up, you want to have it anonymous, just change your chat option to all panelists. We'll read out the question, but we won't identify you. So we'll come back a bit later, Jen, and see if there's any questions.
No problem. So that brings us to our first poll. So some people may be aware that this year the New South Wales Mentally Healthy Workplace Strategy for 2018 to 22 was released. What we're really interested to understand is how many people are aware of that. So Linda, if we could open poll 1, please. So we'd love to know, have you read it? Yes, you haven't, but you're aware of it, or no, you're not aware of it at all.
Okay, we're just collecting all those answers there. For the people who are currently sitting in progress at the moment, make sure you do hit that submit button on the bottom right-hand corner, just so that your response is also added in the results. Okay, we've got about 3 seconds. Everyone just to hit submit for me, please. Okay. All right, so we're just tallying up those results, and I'll display that for everyone in about 15 seconds.
Is that the final results there, Linda?
Yes, it certainly is.
Okay. So what we can see is that 18% of the people in the audience today have read it. So they're aware that there's a strategy for New South Wales. They've taken the time to read it. So that's 18%. The highest percentage, 40%, is for B. So no, they haven't read it, but they are aware of it. And then 35%, so not too far off, have said no, they've had no visibility of that at all. So for those who are aware and for those who are not, the New South Wales Mentally Healthy Workplaces strategy was released in June of this year, and it's got 3 key objectives. So to reduce the impact of mental illness, to improve health and social outcomes, and to improve capability and reduce productivity costs to employers. So it looks at 4 areas. It looks at awareness raising, evidence-informed interventions, research and programs to enable New South Wales workplaces to act. So that's a really simple summation of what the strategy is about. So we're going to go to another poll now. So Linda, I'll get you to open up poll number 2. So our next poll, we want to know, out of everybody listening, do people have a mentally healthy workplace strategy in place? And is it part of their safety and wellbeing strategy, or is it a standalone strategy? Or do they not have a strategy at all in place? So Linda, if you could open up poll number 2, that would be great.
Okay, it's already been opened and we're collecting all those answers now. 10 seconds left of the poll, so everyone in progress, make sure you hit that submit button for us.
And I think this is a particularly interesting one. We talked a little bit about how much dialogue there is in New South Wales and in Australia around mental health. So it's interesting to look at how many people are putting a formal strategy in place in their workplace.
Okay, the results are up for you, Jen.
Okay, so that's really interesting. So the majority of respondents have said yes, they do have a mental health strategy in place. So 47% are saying that it's part of their safety and wellbeing strategy. 33% have said no, they don't have that mental health strategy in place, but the intention is there, so they plan to. And 7% have said yes, they do have one and it's standalone, so not part of the safety and wellbeing strategy. So they've got a specific strategy around mental health, which is really interesting that it takes that individual, it's important enough to have its own individual strategy, and then 9% have said no, they don't have a strategy in place. So that's a really interesting result, and I think it speaks to the fact that there's a lot of dialogue and a lot of organisations are actually putting a formal strategy in place. So we're going to go to question 2 now for the panel, and Sam, we're going to start with you. And this is about where should an employer start with their mental health strategy. So when I'm talking to iCare customers and they're saying to me, we think mental health is an emerging problem in our workplace, a lot of times employers say they just don't know where to start. They feel a little bit lost. So we'd love to hear from you about any guidance on where an employer should start with their mental health strategy.
Thank you very much. Yeah, look, this is also a really common question that we get at the Black Dog, where we have organisations come to us and you know, this sort of tsunami of mental health awareness training has hit them, and they say that they want to do something, but you know, there's a lot of snake oil merchants out there, and it's very hard to kind of pick what it is that they should be doing. A number of years ago, in an effort to try and address some of this, a number of groups in Australia joined up to create something called the Mentally Healthy Workplace Alliance, and I'll come back to that in a later question in more detail. But one of the things we did within that alliance was to say, okay, well, if an organisation is interested to know what they should be doing, what is some really practical advice that we can be giving them and the steps that they should be taking? And this diagram here sort of really summarises where we ended up. And it's not really rocket science, the overall picture, but I think some of the things that can inform the individual steps, I hope can be useful. The first thing is that you have to get senior leadership support within your organisation. And if you don't have that, then things just don't work very well. Perhaps some of the best evidence around this comes from the research that's looked at interventions aimed at bullying and showed that if you have two different organisations, one where the workers really know and believe that the managers are on board with valuing their health and well-being, and the others where it isn't, and you roll out the same kind of anti-bullying strategy, you get very different levels of effect there. So I think we all kind of know this one's there, but I think it's worth emphasising the need that you actually have to spend time making sure you have that and making sure that the whole organisation knows that that is there. And indeed, one of the first things that we at the Black Dog Institute often do when we're working with large organisations is make sure that we're invited along to senior leadership forums or to the board level and have a conversation with them to make sure they're aware of what's needed. The next step after that is a situational analysis, and this really links with what Nick was talking about in his slides, that different organisations have different challenges, and one of the things that you are going to have to do in your organisation is to understand what are the particular challenges within your group. You know, Nick mentioned that frontline workers, there's particular issues around a lack of control over their job, and of course there's issues around trauma exposure. Some of those things you just sort of need to sit and think about or speak to some people, and it's pretty obvious what they are. Sometimes for some of those other ones, one needs to go into a little bit more detail to find that out. And of course there is probably a range of data that all your organisations is already collecting that can help with that. You know, looking at your rates of sickness absence and your data around psych injuries can often be quite insightful about whether there are hotspots in your organisation where you need to particularly focus. Sometimes exit interviews are one way to get a truly honest appraisal from the staff around what the particular issues are. Going beyond that kind of routinely collected data, then the question becomes whether there is a way for you to understand what are the particular risk factors that Nick talked about. You remember that Nick had, sorry to steal one of your slides, Nick, but you remember Nick had this slide here where there's all these different types of things that can increase workers' risk of mental health problems. And of course, even the greatest workplace in the world with the most amount of money to spend on interventions are not going to be able to deal with all of these. And so the question then becomes, how do you decide which ones of these are particularly important for you? And there are some tools in Australia that you can use to help with that. A lot of your organisations will already be doing some type of employee survey. Indeed, those of you who are from the public service would have been hearing a lot about the results of your recent employee survey and rates of bullying and other risk factors in that. But for those of you who don't have that, you can see in the middle of this slide there's the People at Work project, which is based up in Queensland, which that's part of a research team up there. They'll provide you with a survey that you can use amongst your staff to get an idea of which of these risk factors are particularly important for you. If you're a smaller workplace or within particular teams, then obviously you can just sit down and have a chat with those individuals about it. The other thing which is relatively new here in New South Wales is part of the work that Safe Work New South Wales have been doing following on from the launch of what was it? Was it called a framework or a guideline? Whatever thing we were voting on earlier that only a minority of us had read. There's been a range of initiatives that have followed on after that, and when you go to the Safe Work New South Wales website, right at the top, just below the banner, there's now a big sort of coloured picture that talks about the Mentally Healthy Workplace Initiative, and when you click on that, an option that you have is to do a mental health capability check. which is where you are asked a range of questions about your workplace. For example, the question that we just all answered then about whether you have a workplace mental health being strategy and a few others. And I think there's only about 8 or 10 questions now, and at the end of it you get a sense of where you are at on the continuum from just having basic awareness through to a really integrated and sustained approach. This in itself won't necessarily tell you what to do, but it can be a really important part of starting the conversation, both at the senior levels and more generally within your organisation about, okay, this is where it looks like we are, you know, we're only getting 2 out of 5 stars here, let's now have a serious chat about how we're going to improve from there. So you've got your leaders on board, you've got your workers on board, you've got a bit of an idea about what the issues are, and everyone's ready to do something, but then what the hell do you do? Now, some of you will say, wasn't that the question you were meant to be answering for the last 5 minutes? But there was a bit of preamble, and now we're up to that key point. Now, that document there on the right-hand side, Creating Mentally Healthy Workplaces, and I'll put a link to that in the chat box so people can know where to go to download that if they want. Let me see whether that works. There we go. So that's a document that we wrote, and the whole point of that document was meant to be, okay, let's take all of the research evidence there is around things where researchers have tested different interventions in the workplace, and let's look at whether they work or not, and then let's try and summarise that in sort of lay language that anyone managing an organisation or workers in an organisation can understand. And so that's the document there. That rather blurry picture is one of the key things from it, which is really about saying, okay, there's no magic bullet. There's not really one thing that you're going to be able to do to solve the problem of workplace mental illness. But what you can do is you can appreciate that all of your workers are somewhere on that spectrum that Jen was talking about earlier, around from being healthy to being unwell. And there are probably different things you need to do to keep a worker healthy as opposed to respond when somebody's already developing symptoms. So that's the sort of the blue bit at the top, saying there's different things you need to do in terms of prevention or response. The green bit down the bottom is saying you've got to do some things at the level of individual, and you've got to do other things at the level of the team or the organisation. And so when you take that matrix together, what you end up with is those sort of 5 categories of things. And broadly speaking, if you as an organisation are doing something sensible and evidence-informed in each one of those, then you are well and truly on the way to doing the right thing in terms of creating a mentally healthy workplace. So what I was going to do was just to go through a couple of quick examples of what that could look like to give you a sense of what I'm talking about. So for each of those 5 areas, and look, I don't know if it's just my screen, but it's looking a little blurry on mine, so I apologise. I'll just read them out. The first one is around designing work to minimise harm. The second one is about enhancing personal resilience. The third one is around building organisational resilience through good management. The fourth thing is promoting and facilitating early help seeking. And then the last one on the right-hand side is supporting recovery and return to work once people have become unwell. And the key thing is you've got to do something in each of those, and it's got to be sensible and it's got to be evidence-based. So that first one, that designing work to minimise harm, Nick mentioned earlier that one of the key things in some organisations, particularly frontline organisations, is this issue of controlling the workplace. You know, how much ability do you have to decide what you're doing minute to minute, day to day? And of course, you know, there are some workplaces like the police where it's pretty hard, or nurses, it's pretty hard to do that. But you can at least sit down and have sessions with them and say, well, how can we get you a bit more control? You know, can we get you involved in the shift allocation process? Things like that. And so what is sensible for your workplace to go in that first box is really entirely dependent on that earlier step about what the issues are around the job and job design that's particularly pertinent for the group you're thinking about. The second thing is this business of resilience training. Now, I really put this in there to try, and or Nick and I put this in this model amongst the other people, was really around trying to future-proof it, because there's a lot of talk about individual resilience training, and I'm sure many of you have had people out trying to flog resilience training to you. My view of where the evidence is at, we are now at the point that we know that you can teach people some practical skills that do increase their resilience. So mindfulness is perhaps the one that's most well described, that if you can teach people that ability to not get stuck and ruminate on thoughts, to be able to step back from their thinking, that increases their resilience when they go through a stressful situation. The issue is that takes time and effort to teach people. So anyone who's trying to tell you that one-off resilience training is going to do anything is pulling your chain. What you need is an ongoing way to do it, and interestingly there's some stuff with online training and apps and things like that that are now getting there. But I think really at the moment that's something that's mainly talked about in higher risk industries. What I think is more relevant for industries more generally is thinking about resilience at the broader organisational level. And for me, this is where you really talk about making sure that your managers are well trained and know what they're doing. And I'm going to come back and talk about that in a little more in a second. Just quickly going through the other one, you know, we've talked about how Australia is awash with mental health literacy. There probably is an element that needs to sort of be topped up regularly, an Are You OK Day, making sure your EAP providers are being promoted, all of that type of stuff. And my suspicion is most of your organisations are already doing okay in number 4. They may not be, there may be room to improve, but I think this is the one that traditionally where things operate a bit better. And then sort of thinking about good return to work policy, making sure that you think of novel ways to get people linked up with good quality mental health. You know, for Nick and I, one of the frustrations when we see workers' compensation claims is where we see people that have put their hand up, said they need help for a mental health problem, and then somehow go for months or years without getting good quality evidence-based treatment. And so sometimes, and of course that's a failing of the health system often, or the private health system, but sometimes the organisations have a role to play there. Now, all well and good for me to say do something sensible and that's evidence-informed in those 5 areas. How do you know what's evidence-informed? Well, if you follow that link that I gave you and you go to that document, then you'll see under each one of those subheadings, we've reviewed the evidence for the different types of things and given a number of ticks depending on how strong the evidence is, and a bit of advice about what to focus on. That document came out a few years ago now. As part of the Mentally Healthy Workplaces strategy, Nick and his team updated that. So those of you in New South Wales can go to that document and can get a slightly updated version of that table. Okay, now, what about, and so often when I'm meeting face-to-face with organisations, they say, yeah, that's great, but what about if we just want to do one thing? And of course I started off by saying you shouldn't just do one thing, you've got to have a combination of things. But I think the best bang for buck is really around that middle ground, about making sure that if you're only going to do some things, make sure it's focused on those people that are either really at high risk or already getting symptoms. And the key people there are the managers. And you have to make sure that your low-level and middle managers know what to look out for and know what to do when someone is struggling or when someone begins to take sick leave. And you know, they're the key in all of this, really. And just because I know everyone would be terribly disappointed if we didn't mention a little bit of research in this talk. one of the things that we've been investigating about, well, okay, fine, we all agree managers are important, but can you really train them to do these things properly? We did a thing with the fire service here in New South Wales where we trained their managers about how to have those conversations with workers, following these sort of steps, you know, saying, well, if you're worried about someone, you've got to contact them early. We're not asking you to be a lay therapist, we're asking you just to be a supportive, empathetic manager that can help people find help when they need it. And then we did a proper trial where half of the managers got the training, the other half didn't, and we followed them up. And what we found was that the managers who were randomly assigned to get this training, they were more confident, their behaviour changed towards the staff, and perhaps most importantly from an economic point of view, you could see a measurable difference in the rates of work-related sickness absence, and in an Australian context that means work cover claims amongst those groups where the managers got this 4-hour training. So a massive return on investment of 10 to 1. So that's my sort of brief run-through of what you should do and what I see as the priorities.
Wonderful. Thank you, Sam. I think a standout for me in what you've just said is encouraging people not just to do one thing, but to do a combination. So often I'll be speaking with employers and they'll say, we've done some mental health awareness training and they feel like they have done what they need to, but there is much more that we need to encourage people to be looking at across those elements that you just talked through.
I agree, so, and there's no point going and doing mental health education training, encouraging your employees to speak up if they're having problems. If you haven't, for example, trained your managers to make sure they know how to deal with that when it happens. And if you haven't got your kind of policies in place to make sure you know how to handle someone when they're getting treatment for depression or anxiety or whatever.
Yeah, absolutely. So Nick, anything that you would like to add with regards to strategy?
So I've got to do my thing as well. Yes, thank you. Yeah, I just want to reiterate the thing. I think that sometimes you might have lost it, as Sam sort of described so much. It's just this concept of senior leadership, and there was some work in Europe where they really began to get these indicators of mental health and well-being onto corporate reports. And I think the more that we can actually get such things as corporate reports or KPIs of senior leaders, that's when things start to change, is when there's transparent and open reporting about these. So again, I can't emphasize enough that importance of senior people being engaged in the process.
And that's a really interesting point, because we can talk about let's get senior leadership support and commitment, and that's a really important part. But what is going to ensure that long-term commitment, and KPIs are a really interesting way to look at that. Great.
And I think that's why lots of people have, not lots of people have been trying to make the economic argument for doing that, because that's what gets it onto the board and the very senior management.
Yeah, absolutely. So question 3 for the panel is looking at resources. So we've talked a lot about Black Dog, Beyond Blue, there's Superfriend. Employers now have an absolute wealth of resources and information at their fingertips with regards to mental health and tools that they could use. So how should an employer navigate all of that information? How do you choose the best information for your organisation? So Nick, we might start with you.
Sure. I think you've just mentioned something really important. The number of times we get people asking us, what are the things we should use? What are the apps that we should provide for our employees? I don't know if people are aware, there are now 500,000 health and well-being apps on the App Store and Google Play. We actually reviewed all of those that were aimed at depression and mental health, and only 32 of them had any evidence they did anything. Rather disconcertingly, several of them do nothing, and a couple of them possibly did harm. So organisations may be buying things or providing things that do harm. And currently, I think that there's a real need for some form of clearinghouse, really, within New South Wales and elsewhere, of what are the digital resources and ones that are, for instance, aimed at, if you like, the different areas Sam's talking about. So, you know, the digital resources that enable you to think about all of your workers or particular high-risk groups or people returning to work, where there have been interventions designed to actually be able to guide people to where there is evidence. There are lots of shiny, glittery things with very good marketing people and fabulous-looking websites that actually have no data behind them at all that they do anything. I think we're in a real world of caveat emptor, and I think you really need to look at what your trusted sources of information are, rather than the well, that's what Sam calls them, the snake oil merchants turning up in their nice cars and selling things to the human director of human resources that looks great but actually has nothing behind it. We're in the world of emperor's new clothes in this area.
Sam, what would you add to the topic of resources and how to choose the best ones? Sam, have we got you there?
Yes, sorry. It's amazing how difficult it is to remember to turn the mute button off. I'm really sorry. I think I agree with Nick. I think we're a little lucky now, though, that over the last few years the mist has cleared a little bit, and there are a couple of beacons out there of places where you can go to get information. So I mentioned that the SafeWork New South Wales site, which is really the new stuff that's come up there just over the last few months. A lot of that's really impressive. Conflict of interest. Obviously, I'm from the Black Dog Institute, but we do spend a lot of time trying to make sure that we update the type of stuff that we have on our website with the evidence as it comes in. Beyond Blue have their website Heads Up that many of you will be familiar with, and that has a lot of good information on it, and the Mentally Healthy Workplace Alliance was involved in doing a lot of that. I think I've got some more specific things here. So one of the interesting things is that as part of the stuff that SafeWork New South Wales is doing, that they now are subsidising a number of interventions that the review that Nick did showed had a good evidence base. So, for example, if you're a medium-sized or a high-risk industry and you want to get some independent consultancy to help work through it, or if you want to, get some evidence-based mental health training, you can now apply to SafeWork New South Wales to get them to help with the funding of that. There's lots of free stuff on the Black Dog Institute and their Heads Up websites. The other things that Nick talked about in terms of resources and apps and things like that, so for example, the Headgear app, that's one that Nick and I developed. That's available free on the App Store or the Android store. Just been through a big trial of workers in Australia, and the results of that will be coming out early next year, but looking quite positive. In terms of if you sort of have like an intranet page and you want to be able to promote resources for your staff who want to go and seek help, there's a couple of really good ones there. There's an online website called MindSpot, which is the second to bottom one there. Federally funded, very evidence-based. People don't need a GP. They can go online, answer some questionnaires. If they've got significant depression or anxiety, then a psychologist speaks to them over the phone and talks them through some of the online treatments. Totally free, totally doesn't involve your GP, so it stays out of your medical records, but very evidence-based. There's a similar one called My Compass there. So I think what I tried to do on this slide is just list a couple of the ones that were free and evidence-based. Obviously, once we start getting into the paid world, then there's a whole lot of other things that are there. But I thought perhaps it was helpful to start with the free stuff. perhaps I'll stop there. I'm aware there are some questions flowing in. So.
Yes, so there's quite a few questions that have come through, which is fantastic. Sharon, could you start reading those out, and we'll throw those to Sam and Nick.
Yes, sure, Jen. The first question came in privately, and I think Nick is looking to answer this one. And the question from the participant feels that Australia still doesn't recognise burnout as a medical condition as Europe does. So Nick, do you have a comment on that?
Yeah, a couple of comments. Firstly, there's only a couple of countries in Europe that recognise burnout. Most of them don't recognise burnout. Burnout isn't a medical diagnosis or a psychological diagnosis. It's not actually a condition that we diagnose as such. Now, you know, those things may in and of themselves not necessarily be a problem. And most people with burnout can actually be described with another condition, and that might be depression or some form of anxiety. So if you really want to label it, most people with burnout would meet one of those labels. And a number of researchers, a number of people generally have a real problem with burnout, and there's two reasons why. Firstly is it's about labeling, and if you are labeled as burnt out, for me, that's end stage. And whereas if you're being given a condition such as depression, anxiety, that's something that you recover from. That's something that may be amenable to treatment or environmental change, and it's temporary. Whereas burnout and being burnt out is an end stage phenomenon. So I think it gives someone a very, very different label about them and what their expectations should be. And I think actually it's detrimental to people to be labeled as burnt out, because you're a dead end. It's a bit like disability used to be that label sort of 15, 20 years ago. If you were disabled, that was it. You're kind of on the scrap heap. Things have changed now. So that's my concern. And also burnout is, in terms of its prediction, you know, there was a fantastic study of junior doctors showing that something like 60%, it was certainly just over the median number of junior doctors, are burnt out by the time they finish their medical degree. Yet the vast majority of them go on to very long and very lucrative careers. So it actually doesn't really have any predictive value at all. So I would really counsel against going down the burnout route. We've got lots of good ways of describing mental health problems. We don't need to take on new ones that have negative consequences.
What's our next question, Sharon?
We've got a question coming in from Esther. Thanks for your question. I think it may have been answered, but we'll just check. It was a question for Sam. You mentioned resilience training can be taught on an ongoing basis. What kind of apps have you seen do this well, and how have you seen this integrated well into a workplace setting? Is there anything you want to add to what you've already shared, Sam?
Yeah, look, I like that question about how do you integrate it. I think one of the risks of an organisation promoting resilience training is that inherent in you doing that is the idea that anyone who gets unwell, it's because they weren't resilient enough. And it really sort of shifts all the responsibility onto the individual. So I don't like the idea of resilience training being rolled out by itself, or even if it's not rolled out by itself, having the optics of being rolled out as a standalone thing. I think how it needs to be integrated is to say, actually, this is just part of your normal training, in the same way that you do training for fire drills and things like that. This is just part of how we look after you as an individual. But this fits into all the other stuff that we as an organisation are doing to make sure that our managers and our workflow and everything else is promoting resilience at that level. In terms of what it looks like, so we've just recently published a systematic review of all of the studies of resilience training. What they find is that in terms of teaching people skills, the only two that really seem to be able to increase resilience at the moment that we know of are mindfulness training or cognitive behavioural therapy training, or a combination of those two. And what we know at the moment is that you can increase people's perceived resilience. Whether it actually sort of has lasting benefits over the coming years is what we're still trying to look at the moment. I've got a conflict of interest. One of my PhD students developed an online resilience training program called Raw Mind Coach, Raw as in R-A-W, and she's just finished off a randomised controlled trial of that, which showed that that works. So I think that's, as far as we're aware, that's the first time an online resilience training program has been shown to work. But I'm sure there will be others that are coming along soon. The only other thing I'd add to that is resilience training doesn't just have to be about those sort of cognitive skills. There's pretty good evidence out there that promoting physical activity, promoting social interactions, all of those types of things enhance resilience as well.
Can I just jump in on the mindfulness thing? Is having done a couple of trials of mindfulness training. There's mindfulness and there's mindfulness, and I think that there is. You really need to, if you're going to do the face-to-face training, we found you really need good people, and it needs to be done over several weeks. And the key here is being able to enable organisations to enable people to go to it. So we certainly found we rolled out in 2 organisations, both public sector, one of which had a very good uptake where managers were enabling people to take slightly longer lunch breaks to go to the sessions. It was well supported. And in the other organisation, which was the only way we could do it was by running it after hours because they couldn't create the space within the organisation to do it, the uptake was abysmal. So when you're running anything like that, you've really got to embed it within the organisation. And like Sam says, the good training takes weeks, and it takes an hour or 2 per week, and it takes a lot of practice. And if you look at the evidence about mindfulness, the effects wear off very quickly when you stop doing it. So it's definitely one of those things. It's a bit like yoga or exercise for that matter. It's as good as it lasts. And so if you're going to do it, you need to sort of embed it and think about how you introduce it into your organisation, not as a one-off, but something that rolls on and keeps on going, a bit like gym membership.
Great. Sharon, there's quite a few questions I can see there in relation to KPI, so that seems to be an area of interest for people. Could you read out some of those questions?
Yeah, sure, Jen. I think there's 2 questions that are very similar. They're looking at what sort of KPIs do you suggest for senior leaders that will have a positive outcome? And one of the participants, Simon, has got some suggestions. Is it sick leave hours, staff turnover, workers' comp claims? Will I throw that first to Sam? Would you like to comment on that?
Yeah, it's a good question and a tricky one, and I'll be honest, I was really hoping you were going to throw it to Nick when I read it. I think in terms of KPIs, there's a balance to be had between stuff you're already measuring or your organisation is already measuring. And so that is where things like sick leave and workers' compensation claims come in. The problem is there's a long lag time for those ones. Well, there can be a long lag time. I mean, that trial of manager training that we saw, we saw that effect over 6 months, but to be honest, we're a bit surprised we did, because often it takes much longer, and it's a messy signal. You know, all you need is a flu epidemic in your workplace, and that totally changes all your sickness absence things. And of course, if part of what you're doing is going out there and encouraging people that it's okay to ask for help and that you'd prefer people to, you know, have a short period of time off early rather than a long period after it's been let go on, then you may actually see an increase in sickness absence before you see a decrease. So I think those ones have a role, and I think particularly at the higher level of your organisations, the reality is that that is where the economic argument will be made. I think really if you want proper measures of what's going on, then you're going to have to find a way to go out and collect that data yourself. and indeed a lot of the stuff that we do here at the Black Dog with organisations is to give them advice. Because a lot of organisations survey their staff very regularly but don't ask terribly useful questions, in my opinion. And I think one of the things as a researcher that really gets hammered into you is you only ask a question if you know explicitly what you're going to do with the answer for that question. And so, you know, there's quite good, timely, short questionnaires that you can use to gather some key information about people's confidence. You know, for example, managers. I would say if you're going to measure one thing in managers, what you want to know is how confident do they feel in having those conversations about mental health. And you can do that in a single question, and if that's going up, then, you know, you're winning in that space and you don't need to ask other questions. And so I think it's more about picking a couple of key questions that you ask specifically for this purpose.
Great, thanks, Sam.
To add around the other side of that, firstly, I agree with Sam. God help me from another 1.5 hour long employee engagement survey. God. They're mind-numbing. Some other countries have actually taken the idea and moved it onto a sort of corporate social responsibility approach. And in some countries, there's an organisation called Investors in People. And Investors in People started off around education and then moved into corporate well-being. And it kind of fits with SafeWorks' benchmarking tool. And you actually get a logo. It's a bit like, you know, one of those sort of plaques that is actually displayed proudly on the headquarters of organisations. So if you go to London, if you go to the headquarters of London, right outside their headquarters in the city will be how well they are thought of by Investors in People, which is effectively a benchmarking tool about training, well-being, education, and other aspects of corporate social responsibility. They're things that actually form the board of directors. People report on some of these. There's a really good organisation called Business in the Community, which many large multinationals have bought into around what should be the high-level reporting KPIs for this. So, and I think, you know, it's good to ask specific questions. In many ways, I'm less concerned about what specific one it is immediately, but the fact that people begin to report on some things are important. I think the framework and the benchmarking tools are really, really useful in this area. So taking that CSR approach to changing organisational cultures is, I think, the way forward here.
Very interesting, thank you. Sharon, are there any additional questions there?
No other questions coming in, Jen, but it's not too late. If you'd like to pop a question in the chat pod, we still have a few minutes left, so pop it in there now.
I've actually got a question whilst we see, and it's a question for Nick. Nick, one of your slides talked about some people have higher risks than others, and one thing I've heard a lot of organisations talking about lately is psychometric testing. So there are organisations that work in high-risk industries where their people are exposed to potential violence and assault on a regular basis, and they're saying, should we do psychometric testing to minimise the risk of psychological injury claims? What's your view if we know that some people have higher risks than others?
This is a really tricky one. My personal view is, in fact, my personal view, and I think the evidence shows this, is the issue becomes around false positives. Our level of knowledge is such that what's called false positives. So we have people who will flag up as high risk who actually won't be at risk at all if they are exposed to a problem. So we do know various vulnerability factors. We know, and it's very common, you know, the #1 vulnerability factor for an episode of mental ill health is having had one in the past. You know, that's full stop, the #1. Feeling discriminated against for any reason, doesn't matter whether it's sort of gender, age, culture, discrimination, very big risk factor. Loneliness is a big risk factor. In fact, many of these knock out some of the workplace risk factors when you look at what it's really a lot of what goes on outside, some aspects of your exercise and other things as well. So yes, we could do this risk modelling, but I think the risk modelling is might be useful to give to an individual to say, look, you're low, medium, or high risk, you are, but I think that's something that we give to people as a private piece of information to get healthy at work are. I think there's real dangers because our predictive ability of our psychometric testing is not good enough to implement in any of the sectors, and even in the high risk sectors where we know, for instance, in first responders that you will have a traumatic event, it's just a matter of time. You will end up knocking out a lot of people and excluding them who actually would prove to be resilient, and we're better off actually thinking about how we help people improve their resilience, manage the traumatic events that they're exposed to, manage the risky events that they go to. So I'm personally am not in favour of the psychometric testing to discriminate whether you take people on or not. Sam?
I would absolutely agree. We've spent a fair bit of time looking at psychometric testing in really high risk groups like the military and first responders, and we're yet to find any convincing evidence that it's able to reliably predict future mental health problems or future psychological injury in any way that's useful. And you know, as Nick said, there's huge problems about, well, yeah, I mean, I think there is some evidence out there that there are some tests that might be useful to try and decide how someone's going to perform in certain occupations, but in terms of trying to predict whether people are resilient or whether they're vulnerable to mental health, then there's no evidence at the moment that psychometric testing can do that in high-risk populations, let alone in normal-risk workplaces.
Thank you. So Sharon, if there's no more questions, I might hand over to you to close.
Okay, and I think we've just had one last question come in. I think we've got time to fit it in, if that's okay with the panel. From Agnes, healthcare workers are often affected by the poor outcomes of their patients, second victims. What can we do to promote the well-being of our healthcare workers?
Nick or Sam?
So there's a lot of focus around healthcare workers at the moment, and look, I think there are particular issues around healthcare workers, but I think the solutions are pretty similar to what you see in other workplaces. That the same types of things you need to do need to be done for healthcare workers, but you just have to think about in what ways it needs to be modified. I think what is particularly, I think there are three things that really complicate healthcare workers. The first is that they obviously know about health and mental health, but their mindset right from undergraduate training throughout is that they are on one end of the stethoscope and people who are ill are on the other end. And so they, you know, there's real barriers, more barriers than usual to get over for people to acknowledge that they may need help and to normalise that. The second thing is that they are exposed to upset and to stress in the workplace. Interestingly though, when you look at the studies, for some people that's a really key reason why they've become unwell, but actually for most it's all about the work environment, whether they've had a good manager, whether they feel supported, all of those types of things, that they expected that unpleasant stuff to happen on the ward and that they were okay with that. What they're not okay with is not being supported and adequately rewarded, not just financially in terms of all the other things that go along with work, not being respected why they do that. I think, you know, once again, what a lot of it gets back to, if I could only do one thing in a healthcare setting, it would be about thinking about the managers and making sure that they have the proper skills and training to support people after they're exposed to a vicarious incident like that.
Thanks, Sam. Nick, anything further for you to add to that?
The other thing is the culture of healthcare workers. There is a culture that you don't go off sick, because if you go off sick, all the healthcare workers are generally so stretched. If you go off, there's no one replacing you. People work in small teams, small groups. If you go off sick, your colleagues, your small group of co-workers have to step in and work harder because you are not there. So I think there is a real culture of waiting until you're broken before you actually take time off, which is a difficult one to address within such a financially constrained system. But we've got to think a little bit more constructively about how to do that.
Great. Over to you, Sharon.
Okay, thank you, Jen. And first of all, I want to say a big thank you to our panel. Professor Nick Lozier, Associate Professor Sam Harvey, thank you so much for joining us today. It was a wonderful conversation, and I think an ongoing conversation. Thank you to Jen Cameron for being a wonderful moderator for our panel. You can see there's a couple of email addresses on the slide. It is an ongoing conversation at iCare. We'd love to hear from you, so please drop us a line if you've got a question, a comment or observation, and let's keep this conversation going. Finally, for today, just want to let you know two things. Firstly, we love feedback. So please let us know how this webinar was for you. Let us know what went well, what was useful, and what we could do to enhance these sessions going forward. And just want to let you know we've got another webinar coming up on the 11th of December. You can see the details on the screen. Bernard Salt, who I'm sure is familiar to many of you, futurist business advisor, often in the media, he's going to talk to us about implications for New South Wales Government of demographic and social change. Bound to be a really interesting session. Thank you to all of you for joining us. Thanks to those who really got involved and asked questions. We appreciate that. And I'm going to hand over to Linda now just to let us know how to close the session. And also I need to say a big thanks to Linda at CPD Live in the background, making sure you're all connected. Have a lovely day, everyone. And over to you, Linda. Thanks.
Thank you very much. I might just echo that and thank Jennifer, Nick, Sam and Sharon for an excellent webinar. Also a special thanks to everyone for your participation and all of those questions that came into the chat box, as well as your participation in the chat, in the poll questions. Thank you very much, everyone. So like Sharon said, that does officially conclude today's webinar. So to exit, please click on that cross on the top right of your screen. Just once again mimicking what Sharon's just said, you'll be automatically redirected to a feedback form. Now just letting you know, it only takes about 30 seconds to complete. However, feedback's really, really beneficial for iCare Risk Education Express, as well as our panel of presenters today. So we would really, really love for you to leave your thoughts. Just also letting you know that everyone who has registered today will also receive a link to today's recording, which will be emailed to you within 24 hours. Okay, if there's nothing final there, I might just pop on the music as you all exit, but thank you once again, and we really, really hope to see you in the next webinar in December. Thanks, everyone.